Hello and welcome. This video is on preparing for the MRCPsych Paper B. I have divided this topic into two videos, in fact. The first one is I'm posting today, and the second one I will post a bit later. So the first one is clinical part. That is the topic of our today's video. So MRCPsych Paper B is also a written paper just like Paper A. However, it assesses critical review and the clinical topics in psychiatry. So today's discussion is on clinical topics, and Paper B can be taken before Paper A if you were already in psychiatry training in any country. And how many questions? So Paper B is also just as similar as Paper A. So it is a 3-hour exam and 150 marks, 150 questions, and approximately 2/3 MCQs and 1/3 of EMIs. So now a discussion about pass rate and pass mark. This Paper B is in fact a difficult exam, and pass rate varies widely depending on the competence of the candidates. So it is pass rate is somewhere between 45% to 65%, or it may also be slightly higher or lower. And pass mark in the last 2 years were around 64%. So this is the mark distribution. So the first topic is organization and delivery of psychiatric services. There will be 8 questions. General adult, which is the biggest part of clinical topic, it is 30 questions. Old age psychiatry, 14 questions. Psychotherapy, 8 questions. Child and adolescent psychiatry, 14 questions. Substance misuse, 10 questions. Forensic psychiatry, 8 questions. Learning disability, 8 questions. And the last one is the biggest part, that is critical review, 50 questions. It is 1/3 of the exam. So I will discuss that topic in the later video. Now the preparation time. The total preparation time for the whole exam is 3 months if you can study 2 to 3 hours a day in a calm and quiet environment. And the preparation time depends on how much time you need to spend to thoroughly understand the critical appraisal contents. And you might also consider joining WhatsApp groups, because it helps if you study in a group, especially about the critical appraisal topics, but also for the clinical topics in Paper B. So, and it is recommended that you have at least 1 year of clinical experience in psychiatry before you attempt the exam, because there will be a lot of decision-making questions. So the must needed resources are SPMM, the Morsley Prescribing Guidelines in Psychiatry once again, and the NICE guidelines in about various psychiatric disorders. There are some optional resources as well. There is Oxford Handbook of Psychiatry, that this is for percentages and other references, and Psych Mentor, Question Bank, and explanations. Okay, so and there is something special to mention here. So the old age psychiatry and eating disorder psychiatry, these are not mentioned not mentioned in a good way in like the usual resources. So try to understand and read these topics from any books you can find. Now the SPMM resources. So SPMM has 4 types of resources. One is SPMM notes, and the last 3 are questions. So about the questions, the first one is SPMM chapter-wise high-yield questions. There are SPMM mocks, and there are SPMM fresh questions. And these fresh questions contain some of the questions from previous exam. So how to study the SPMM resources? Number 1 is, this is totally opposite to Paper A. That is, do not read the notes first. Practice a chapter from high-yield questions first. Try to understand the explanations of all the answers, and then read the relevant notes for the chapter. However, you do not need to memorize anything from the notes. Just give a read, just have a gross idea on what's there, and continue this way until you finish all the notes and high yield questions. And if you find difficulty in understanding any of the topics, then ask people who know, especially in the WhatsApp group when you participate, and also search Google if necessary. And SPMM question notes and high yield questions are not updated. However, the SPMM mocks and fresh questions are updated. So study the NICE guidelines for any kind of treatment recommendations. And some people pass without even reading SPMM notes. However, my opinion is some background knowledge is always good. And however, the question bank of SPMM is absolutely essential. Now, how you can study the mostly prescribing guidelines? So, in my opinion, one of the reasons people fail in paper B is because they do not study this book, apart from the weakness in statistics, of course. So I would highly recommend you to try to read this book thoroughly, and it would be easier if you had studied parts of it during paper A preparation or your any clinical attachments. And how to study the NICE guidelines. So here, as I have mentioned, SPMM notes and high yield questions are not updated according to the recent NICE guidelines. So read the recent NICE guidelines from the website and summarize important points. Write these important points down in your notebook and go through those often until you know those by heart. So this will help you a lot during the exam. And what to do 45 days before exam? Ideally, you would have finished reading SPMM notes and high yield questions by now, so start doing SPMM mocks. And there are currently 13 mocks in total. They might add 1 or 2 in the next few months maybe. And of course, score yourself. And read the answers and explanations for all the questions, not just the ones you have made a mistake on. And if you find that you are confused about any topic, go back to relevant SPMM notes or MRCPsych or NICE guidelines or whatever resource you may need. And lastly, practice the SPMM fresh questions. As I have mentioned before as well, these questions, some of the questions are real questions from the previous diets. And don't get discouraged if your score is low in these questions, and follow the same strategy like the mocks for the answer explanations. And how many times should I study the SPMM resources? Study the notes only once, not more than that. It would not be fruitful. The high yield questions, I would recommend at least twice, and the mocks and fresh questions, if you have time, continue to do it until you are very well aware of what's there. And when you're close to the exam, the SPMM mocks and fresh questions are far more important than anything else. Now the question pattern. There are some questions which will be repeated. However, around 20 to 30% clinical questions will be extremely difficult. And the question stem might be simple, but the options are very, very close. So it is very difficult to choose one of them to answer correctly. And to answer these questions, you'll have to apply your clinical judgment and decision making, which is where the training thing comes in. If you have more training, you are more able to make decisions, and you will be able to score better in paper B. And remember one thing, you might never be able to guess the correct answer even after the exam. I got 100% marks in 2 of the topics. One is addiction psychiatry, another one was the old age psychiatry. I only know that I only know the answers to those questions about these 2 topics. However, I am not sure which questions were right in the other topics. So this is how it goes. People cannot guess the answers even after they have passed the exam and searched the answer for all the Googles and books and everything. And now a frequent question is what to do with the prevalence data. You will see a lot of prevalence data in SPMM notes and questions. So what I would suggest is get a general idea and write only very important prevalence data in a notebook which you will go through often, and important ones are usually tested in SPMM questions, so try to remember only those, and like don't try to memorize it all. It's as I said, it's the idea that is important more than the actual numbers. Thank you so much. So if you have any questions, please comment and subscribe this channel, and also you can like the Facebook page. Thank you so much for your patient hearing. Goodbye.